While getting a vaccine is a matter of national and international concern, there are small, low-cost, high-impact strategies that can be put in place in every hospital right now that will actually help to strengthen our healthcare system. Joining us now to explain this is the University of KwaZulu-Natal's Head of Internal Medicine, Professor Nombulelo Makula. A very good evening to you, Professor. Lovely to be chatting with you. Now, we've just received the second batch of the Johnson & Johnson vaccine, and there really has been a lot of talk on the likelihood of a third wave. How likely is this?
So it's all in our hands. I think even before, ahead of this, what turned out to be the second wave, it was within our hands, and we still had a second wave. So even now, at this time, it is in our hands whether we have a third wave or whether we avert it.
And what would you say are the factors that will affect or determine whether or not we do, as a country, actually go through this third wave?
So if we just go back a little bit to the first wave, which was really bad, and we lost a lot of loved ones, we lost colleagues, but nothing could have prepared us for what we experienced with the second wave. We actually expected that the second wave would actually occur a lot later than it actually did. But the events around, late November, early December, with social gatherings, celebrations that were taking place by students, celebrations at universities, all of those social gatherings, and then the movements across the provincial borders spiked, precipitated the spike that turned out, to give us the worst wave that we ever could have expected. The health system buckled under pressure. We couldn't cope with the critically ill patients that we received. So we need to reflect on what actually triggered the second wave as we think about how we can actually prevent the third wave. I can tell you from my own personal experience that we were so hard hit, and I'm sure a lot of other colleagues as well, that for 2.5 weeks after we started seeing large numbers of patients, I literally was paralyzed. I couldn't do anything. I was completely finished. So we really have to do everything possible to make sure that we prevent another wave.
And we'll talk about the impact that the second and the first waves actually had on the healthcare profession in just a moment. But I'd like to pick up on this statement that you made. You were speaking about, quote unquote, the reckless behavior of South Africans, the irresponsibility, if one could call it, of partying, of being in super spreader events as we're nearing the festive season. But also, quite interestingly, that was the time when the mutated version of COVID-19 started rearing its head. How much of an impact did this, second version, this mutated version of COVID-19 have on the second wave? So
Tammy, by their very own nature, viruses mutate, viruses change. So the longer the virus is with us, the more it's going to mutate. So there are, behavioral strategies that we can actually adopt to ensure that we stop the spread. So we can't just ascribe it to the variant, the new variant that was seen genetically, because it is still the social gatherings. Right now we are heading towards Easter time, which is a very important time in our calendar, and we celebrate Easter, and gather together to celebrate Easter. So time, as we did at the beginning of December, we're going into lots of holiday times, and so it is about restricting our movements ourselves making sure that as we celebrate Easter, we are mindful of the safety and the fact that we celebrate it in a way that does not take us back to the events of the beginning of December. Because if we do, then a number of people, again, are not going to see another Easter if we're not able to restrict our movements. So right now, at this time, we actually should be planning to celebrate Easter in the safety of our homes, restrict our movements, and reduce interprovincial travel, because this is another way that the virus is moving. Whether it is mutated or not, the virus is moving with people. So we need to restrict our movements. And those that have symptoms, flu-like symptoms, that indicate that a person may be infected. It may not be an infection from COVID-19, but it's important that we go under quarantine to make sure that we don't spread this infection to others. And once one has tested and the infection is confirmed, it's important that they stay under isolation, and preferably under government isolation, because you know that you're getting isolated safely, you're getting monitored, and if you complicate, you can receive care very early. And this way, we then get to reduce, the severe complications, we reduce the deaths, because we've been able to intervene early in those individuals. And at the same time, we also achieve the goal of reducing transmission in the community, which is the way how the virus is actually spreading and giving us these surges that end up with lots of people dying at the same time.
So, Professor, from a medical standpoint, would you advocate for the government to start eliciting stronger measures as we start approaching the Easter season?
So I will respond to your question as the physician that I am, and not representing any committee of any kind. The physician that I am will actually encourage very strongly that movement is restricted, even interprovincial travel, especially at this time. I'm talking from my own personal experience. Once the wave is gone and a lot of people have died, and you reflect on the fact that these deaths could have been prevented, and all that needs to be done is to reduce people's movement. I know that but as members of society, if you are going to save people's lives, if we are going to save our families, if we are going or citizens of South Africa, we actually have to take it into our own hands. Without government telling us to restrict our movements, let's make sure that we are moving only when it is necessary. Let us not be congregating in churches in large numbers. Even when we attend funerals, let's be mindful of the fact that this is the place where infections are spreading. So we actually, as citizens of South Africa, need to take it into our own hands without even being regulated to reduce our movements. Let's do it ourselves.
If you could talk to us about the trends.
And also, let me just...
Professor, before you move on, if you could talk to us about the trends of the nature of second and third waves. We saw that the second wave, there were a whole lot more cases reported. There were a whole lot more deaths. Do the waves, as they come, become incrementally more severe, or was this a unique situation? Are you with us, Professor?
There is a lot that we... Yes, there's a lot that we still don't know about the virus, but it's very safe to actually expect that the next wave, if it occurs, would be worse than the previous wave. It's just the safe thing to do, because what we experienced with the second wave, Tamia, I can tell you that we do not want to go into something like that again. When the numbers are counted, they are just numbers. But when you are in the wards and you are seeing these patients and you are seeing the distress and these people are dying around you and the people that you are working with in their numbers. It's like a war zone. You know, it's very difficult for people that are not in the space to understand. It's like a war zone, and nobody out, you know, no one can actually experience it unless you are inside of these isolation wards or in the hospital wards to see the anguish and the trauma and, you know, what the patients are going through. The disease is real. Some people still think that this is just some made-up thing. It is real, and people are dying from it. It's not just a flu-like illness. It's a very complicated disease with lots of complications. So it's safe to expect that if we happen to get a third wave, that it would be worse than the second wave.
Professor, before I let you go, you spoke a little bit earlier on about the psychological and emotional trauma that so many of the medical and healthcare staff underwent. What would you say were the lessons that can be taken from the first and the second wave? And does the fact that we are now in a vaccination inoculation program for healthcare workers, will that somehow assist the healthcare professionals to be able to deal with the third wave, perhaps more efficiently, psychologically, should it come?
Well, you see, what affects healthcare workers, it's not just their own, by the very nature of the work that we do, we actually sacrifice ourselves. Yes, it's good that we have the vaccine, that we'll be more protected, that we're not going to hopefully lose as many of our colleagues as we did. But the reality is that the trauma that we experience in the line of duty when we are managing patients, when we're treating patients who are in dire straits, when we're treating patients and we need to get them into an ICU and there is no ICU bed available. And there's not just one patient that's waiting for an ICU bed, many patients. So that is the trauma that we then experience from not being able, because when you're treating a patient, you want your patient to recover. That is what makes you to feel fulfilled as a clinician, as a doctor, as a nurse, as anybody that's working with patients. That is what, you know, spurs us on, seeing patients recover. But so we need society to just work with us and understand.
It certainly is, Professor, as you are explaining, it's a labor of love. And as you say, you put yourselves there on the front line. We thank you so much for your insight and sharing your personal experience as well on the front line. That's Professor Nombulelo Makula on the eventuality of a third wave. And as you could hear from her, we are hardly out of the woods.